Osteoarthritis has some hallmarks that are seen on X-ray. Besides the symptoms like pain, inflammation, stiffness, difficulty getting up in the morning, difficulty moving those joints, there's things that happen, right? What happens? There's some damage. Maybe it's a trauma, maybe it's gradual biomechanics altering, and then what happens is there's degeneration. There's not enough blood supply to that joint, and things start to fall apart. And there's three major things. One is bone spurs, the other is called subchondral sclerosis, and then the other is cartilage degeneration, or a lack of joint space. The Piezowave can help all three and help you feel and function better. Number one would be cartilage degeneration. The cartilage is this smooth lining on the ends of your joints, right? And it's wonderful. I mean, considering all you've put it through in your life, it's been quite resilient, but it can break down. Like I said, it doesn't have as good of a blood supply. A bone has a great blood supply. You break a bone and there's blood in the middle of it, and the bone pretty much is healing in 6 weeks, right? But you take like a professional baseball player or an athlete that hurts their cartilage, right? They might be out of the game for a year before they come back. Next would be bone spurs. Bone spurs, if there's a jarring of a joint and it isn't as stable as it should be, it starts almost like reaching the bone next to it to sort of create stabilization. That's not, I don't think that's what it's thinking, but that's what it looks like it's doing, right? And so these little claws, and the shockwave, the extracorporeal shockwave, has been shown to actually reduce some of these bone spurs. The third hallmark of osteoarthritis is subchondral sclerosis. Underneath the cartilage is this subchondral bone. And if the cartilage wears, then the bone starts to adapt and get harder, and it can undulate, and these joints just don't have the smoothness to move. In fact, sometimes activity hurts and sometimes inactivity hurts. Okay, so this is where the Piezowave comes in. What happens is this machine sends targeted shockwaves. It's almost like a blade of sound, and we can direct it exactly where we want to. And when that goes in, it actually breaks up scar tissue in the area and brings in new blood, or neovascularization. And this is all well researched. And then what happens, it stimulates new collagen growth. So it can actually help regenerate. I can't believe I'm even saying that. It's so mind-boggling to say that to somebody with arthritis. But yes, this can help you down the road of regenerating an osteoarthritic joint. Check out some of this research. Extracorporeal shockwave therapy for the treatment of osteoarthritis. Shockwave therapy has significant improvement in both pain reduction and functional improvement. That means your joints are moving better compared with the placebo, corticosteroid, hyaluronic acid, medication, and ultrasound. This technology wins, and it's regenerating. It's not breaking tissue down like a corticosteroid. Let's go on. Comparison between extracorporeal shockwave therapy and intra-articular hyaluronic acid injections in the treatment of first carpometacarpal joint osteoarthritis. I like hyaluronic acid because it's found naturally in your skin, in your joints, in your connective tissue. It provides lubrication. It's relatively natural. And so the fact that you're comparing it to extracorporeal shockwave therapy is wonderful. People do feel relief from hyaluronic acid. However, with this technology, you're getting regeneration also. So it's not just relief, it's actually bettering the joint itself. They conclude the use of ESWT in patients from first carpometacarpal joint osteoarthritis leads to a reduction in pain and an improvement in pinch test performance that persists for at least 6 months and a decrease in hand disability. So the hand strength improves as well as the pain goes down. Come on. Okay, what about the knees? The efficacy of shockwave therapy in patients with knee osteoarthritis and popliteal cyamella. Extracorporeal shockwaves were effective in preventing and treating knee arthritis in rats with knee arthritis. I love how they said prevention, so this is actually pushing into the future of your knees, of your joints, of your hips, right? How about preventing knee replacement, preventing hip replacement? ESWT can accelerate the healing of meniscal degeneration and plays a chondroprotective role in osteoarthritis. Another study, this is what I get excited about in my life, another study showing cartilage regeneration. The meniscus is a disc in the middle of your knee, and it's a cushion, and it helps your knees glide, and so it helps ESWT treatment can increase the activity of chondrocytes. Chondrocytes make collagen and decrease cartilage fissuring as well as chondrocyte apoptosis. So it decreases cell death. Chondrocyte apoptosis is cell death. Chondrocytes make collagen. Amazing, right? And fissuring is a cracking in that collagen. So it decreases the fissuring. Sounds wonderful. ESWT could possibly promote the cartilage regeneration by activating chondrocytes and decrease the number of osteophytes. Osteophytes are the bone spurs. How about less bony spurs in your joints? And what about the jaw? Protective effects of extracorporeal shockwave on rat chondrocytes and temporomandibular joint arthritis. They conclude, ESWT was associated with a protective effect on cartilage and subchondral bone structures of TMJ osteoarthritis by reducing inflammation, cartilage degeneration, and chondrocyte apoptosis. So what does this all mean for you? It means hope for your future. It means dancing at your kid's wedding or your grandkid's wedding instead of sitting on the sidelines. It means getting up out of bed and getting up out of bed, not creaking out of bed. Let's team up. Let's make this hope a reality for you.